You are listening to The Healthcare Insider, a radio show by and for the movers, shakers, and innovators in the healthcare industry.
Good morning and welcome back to the Healthcare Insider. I'm your host, Todd Youngblood, joined in the studio as usual by my partner, pal, and co-host, Todd Schnick. Good to see you again, buddy.
Good to see you. We had a good run on this show. We've had some interesting stuff coming through.
I'll tell you what, and I did one yesterday that by myself with a lawyer, and it was fascinating, absolutely fascinating. We got to bring that back, but we're going to keep away from the legal stuff ourselves. I think
that's a good idea.
But we've got a really interesting guest here this morning, someone that's gotten a good bit of local recognition for good reason. So I'm really delighted to introduce John Homonek. He's the CEO of ASR Healthcare. John, welcome to the studio. Thanks for coming in.
Thank you, and thank you for having me.
It's our pleasure, I assure you. Hey, just to get us started off, John, give us a 10,000-foot overview. What's ASR all about?
ASR Healthcare is a point-of-care focused company that provides and services devices that nurses, practitioners, and doctors use at the bedside. That would include mobile carts, tablets, could be on a fixed unit in a room called a wall arm, but anything used to capture and share data within the patient's room.
Well, give us some examples. You listed a few there, but I'm used to a doctor scribbling notes on a file. There seems to be there's more technology behind that now. Talk about that a bit.
Yeah, as health systems or clinics or even smaller practices are moving toward an EMR or EHR. EMR is electronic medical records, and EHR is electronic health records. As we're moving toward that format, they're going to need devices to capture and share this data accurately and to be able to store that and then transfer that data to a specialist or another facility via the patient in that format.
Now, I just want to understand, you talk about the nurse's cart as one of the things you said, and I can picture that, but you're really talking about all the technology that's in the cart, right?
Yeah, the cart itself is just a vehicle that houses the computer or a thin client or a laptop. It's a battery-powered device that's going to give a 10, 12, 13-hour duration each day for each shift and allow them to move this from room to room to room and dispense meds, capture data through charting or pull up charts or other data that's within the health system for that patient.
You know, I've long been troubled as to how slow to adopt the healthcare industry has been to technology. They're making headway and I think catching up to the rest of the world, but I sense that there is some hesitancy on the part of the practitioners and nurses and to accept this. I got to be honest with you, when I'm sitting at home or in the car and I have an idea that I want to jot down, I don't pull up the phone and type it into the little note. I get a notebook out and I write it. And I worry that there are some doctors and some nurses that still like to do that process too. What's been the rate of adoption? Is the marketplace, is your target market, are they beginning to accept this and relish it, or are they still resistant?
There is a little resistance out there, but everybody's going to have to adopt at some point. Some of the early players have had mobile carts or the early stages of EMR, EHR as early as 2006, 2007, and now with mandates and reductions on reimbursements, everybody's coming on board. We saw a slow period during the early part of the year because of the adoption of ACA. And a lot of uncertainty. How is this going to affect us? What's it going to do to our health system? And I think we got through that period and just things have been wide open ever since they've come across that.
Talk about a situation that's perfect for the products and services you provide. So you walk into a hospital or clinic. Describe the situation that makes you say, oh, these guys really need us.
Well, that's true. In a lot of cases they do. It's up to us to help advise in some cases because every health system or every health clinic has a different process and they have a different vision as to how their process should be in promoting efficiencies, accuracy, and sharing patient data and how it's supposed to run and how it's supposed to be stored. So again, every system has its own vision. We're there to try to help facilitate that and look at the pluses and the minuses of each way or using their equipment in getting to the final end.
You know, another thing that worries me, John, is when you go into, say, Emory or Piedmont or Grady, that's a big urban hospital with a lot of patients, a lot of revenue, a lot of resources. I worry about the rural practitioner, the clinic out in the hinterlands, that they are unable. I mean, sometimes they're struggling to get physicians in there. How are we addressing the issue of the rural practitioner having access to this kind of technology and being able to afford that? Is that even a problem? That's something I should be worried about?
Yeah, I think the biggest thing you just hit on was afford. Smaller health systems in rural and smaller community areas struggle. We had a health system that we were working with last year that actually closed their emergency room because the revenue was half of what their expense was. So now they don't have an ER or an ED. So those patients would have to go to another facility, whether it be 30, 60 miles away. And we see a lot of that out there. A lot of them are struggling. Some of the bigger health systems are gobbling up some of the smaller ones to bring them under their wings, so to speak, and help bring some of those dollars down to those rural and smaller areas.
Talk a little bit about how you work with the customer to figure out exactly what their problems are and the right configuration of your products and services that can help them the most. Just walk us through how you work with them.
Okay, typically we deal with the IT departments, and under protest in most cases, they've been tasked with supporting these mobile devices. It's part of the network. It's part of their network system using their devices within their enterprise. So the caveat there is, oh, okay, now it's got a battery. So in some cases, biomed is involved, and in other cases, it could be on a higher level that's watching over the whole program. So you have nurses, doctors, PAs using the devices. You have the biomed people maintaining the batteries in some cases, and then the IT folks maintaining the whole device and make sure it's connected to the network.
I just want to probe a little bit. You used the phrase under protest when you talked about the IT folks.
Yeah, I was going to ask the same thing.
Give us a little more insight into why. I mean, it seems like a pretty essential part of the whole system.
It is. Every health system has their struggles, especially financially, and their IT departments are already overworked, overtasked, and now they're implementing and putting out on the floor more and more mobile carts or wall arms in these devices. Doctors are bringing in all types of different technology, and they're having to adopt a bring your own device mentality or a policy to the hospital, whereas you used to have a standard. We're using HP, we're using Lenovo, we're using this device only. And now they're having to take a look at different platforms and be able to integrate those and support those.
But shouldn't it be the case, though, that when it is implemented and integrated appropriately, that it should make the IT department's job easier? Shouldn't that be their long-term vision and that, okay, let's suck it up now, but this is a good thing for us longer term? Yes? No?
It could. I think with the advent of our product line, which is made by Metro, they bring a superior battery technology to the table. Whether a shift is going to last 12 hours, our batteries are going to last 13 hours. And now we have a mobile card out there with a 10-year warranty on the batteries. So the big thing is problem tickets. Hey, my printer's not working at a desktop. The nurse's station, oh, the monitor quit working, or I've spilled something in the keyboard. Well, these problems are all inherent to the mobile carts as well. But now you have a battery. So if we can remove the battery problem out of the equation, they're going to have less tickets. And less tickets means that they can focus on other things, including being a little bit more proactive instead of reactive.
We'll be right back with John Homonek, CEO of ASR Healthcare, after this short commercial break. Back with John Homonek, CEO of ASR Healthcare.
John, you touched on this very, very briefly in the top segment of the show. I was talking yesterday in the studio with Andy Miller, who's the editor of Georgia Health News, and we were talking about the implementation of EMR and EHR. And very early on, and probably still to some extent happening, is that some of these different systems are not talking well to one another. So when hospital A records all this data, transferring it to another facility they don't speak very well together. And you talked about, after a patient talks to a doctor or a nurse and then the information is transferred to a specialist. Are you seeing issues where the data is not being accepted by the other source because the technology is just not speaking, or is that problem starting to solve itself out?
I feel that that problem is starting to solve itself out. By definition, electronic health records are records that actually go with the patient. EMR, the earlier version of that, was usually kept under the roof of the one facility, and the patient never got to see that or look at that.
I've got to come back to a comment I made right at the introduction to the show. The Atlanta Business Chronicle recently did a profile of ASR. Tell us what that was all about.
Well, we were just recognized as one of Atlanta's top 100 fastest growing companies for 2013.
Congratulations.
Why
Congratulations. Why? That's
why is that happening?
Thank you.
What's caused that?
We have seen a surge of business because of our support and service model and working with mobile carts within point of care. We work closely with most of the major health systems in the Atlanta area, as well as Georgia and over into Alabama as well. We do have a national scope and work with health systems all over the country. However, our sweet spot is right here in the Southeast.
Well, along the same lines, talk a little bit about your differentiators. What sets you apart?
We are an IT company that was founded in 1995 and more healthcare specific in the last 16 or 17 years. So as we adopted the mobile cart or point of care model, we've become highly specialized and picked up engineers from our manufacturer that we have on staff. Today actually is my anniversary of 29 years in the IT business.
Congratulations.
Good for you.
Thank you, thank you.
Let's make it 30.
Yeah, we're going for 30 or more.
Talk about the transition from ICD 9 to 10, whenever that ultimately does happen, which hopefully now will be October of 2015. But how will that impact the work that you do in terms of the programming, the training of these devices? Does that even have an impact on what you're doing? Or is that the IT department's worry?
It's their worry, but it's also going to drive more business for us in upgrading some of their technology, just like the XP to Windows 7 upgrade that Microsoft put out, that we're no longer going to support the software. So that was driving a lot of business and focus in that area. However, now that those have been completed, they're looking back toward the mobile cart fleet, their point of care devices, and how do we better implement these within our system.
Talk a little bit about gaps that you see. Where are the holes in the support system?
The gaps are
too many to talk about.
Well, the biggest thing is the mobile carts, and again, health systems feel like IT departments within health systems feel like they were dumped on by having to now support these devices. It's not a desktop, it's not a printer, it's not a server anymore. It's something that's out on the floor, and the nurses are, in some cases, pretty abusive to these carts, and there's a lot of trouble tickets that are associated with those. We come in, fill those gaps, help support it through a maintenance program or support program. We have battery replacement programs, replacement parts, components, and actually come in and upgrade in the field on site the technology from something that might be 3 years old, and they're going to increase their ROI on that cart by keeping it out another 3 to 5 years. So we help support that and offload those tasks into our house and take that off of the IT guys.
So what drives innovation in your space? I mean, you talked two examples. When you shift from software like XP to 7, then that forces a change. When you talk about ICD-9 code sets to ICD-10, that forces a change. What's going to be forcing change down the road? That's going to continue to require you and your competitors to continue innovating and changing and upgrading and implementing new technology to make the stuff even better.
Well, there's a few things that are changing from what I've seen in the last 6 years. Mobile carts are now more ergonomic. They're looking more at the caregiver's safety as they're using the carts, and now we have an ergonomic keyboard tray that comes all the way up to the work surface, swings right, swings left. The monitor is fully adjusting. Even for patient safety, they're able to drop the monitor down and conceal that screen from prying eyes. The carts are also made with an antimicrobial microband, so it will inhibit any type of bacteria growth that gets on there. And that just brings up another point. Infection control is very important within point of care, and we offer keyboards that have antimicrobial on them, as well as a monitoring system, a hand hygiene monitoring system called Hygreen. It's a monitoring software combined with sensors and a badge that everybody would wear, and it's basically a system that's going to modify behavior. It's going to remind them to, hey, sanitize your hands when you walk in the patient's room. If you walk up to the bedside and you haven't done that, you're going to get a buzz 1 time, 2 times, 3rd time it records that on a server. So it's, again, modifying behavior, and it's going to eventually save readmissions, extended stays within the health system, which all save them money, as well as saving lives. There's 270 people that die each day from healthcare-acquired infections, HAI.
Wow. 270 die a day where? In
Is it
Georgia?
nationally?
In the US?
Nationally.
Wow. Just because of not taking the kind of care to protect against infection. That's amazing. Well, that's a shoot, Todd. I don't know how we oversaw that. That's a critical point in terms of. I'm intrigued by it though that there's a sensor that says if you have not done this, you're going to get notified of that. That opens up some other intriguing possibilities in terms of, because there's a common theme in this show, John, is the notion of we need to go away from reactive fee-for-service kind of care to more proactive care. And as more data is collected to inform healthcare practitioners of things they can do proactively for a patient, that's all going to get integrated into this system, I suspect, yes?
Yes, yeah. As we're seeing it, as a point of care focused company, the devices that capture, share the data, and then the antimicrobial features and a monitoring system. It's really, ultimately, it's going to help us save lives. And we get a lot of satisfaction from that.
Yeah, we've been talking about infection control. Fascinating. I mean, that's the first time we've really talked about that I can recall. Just along the same lines, that's happening right now.
Yes.
Pull out your crystal ball. Let's look ahead 3-5 years. What other kind of technologies do you see coming at us that can have that kind of an impact?
Well, aside from Hygreen, which is the hand monitoring system, hand hygiene monitoring system, we are looking and interviewing a couple companies that will send a device into a room and be able to completely sanitize that through UV, which can be done in 30 minutes. It'll completely zap everything in the room. Another device or company that we're looking at now also has a hydrogen peroxide fog. It takes a little longer to completely sanitize the room, but that's what they're looking at for every crack, crevice, surface within that room when the patient is discharged. Send that in there and clean that room, sanitize it.
What kind of impact do you think that can have? I mean, that's just
It's going to be huge. It really is huge. They're all looking at these things proactively because they're losing money through reimbursements. The average readmission is 8 days, and the numbers are just staggering when you see the number of HAIs that are out there and what can be reduced.
All right. Well, John, I hate to say it, but we are about out of time. Before we let you go, how can people get in touch with you and learn more about ASR?
Well, you can reach us at 770-623-0071, or you can view us at asrhealthcare.com.
John Homonek, the CEO of ASR Healthcare. John, it was great to have you. Thanks for stopping by and joining us.
Thank you.
All right. Well, that wraps this broadcast. On behalf of our guest, John Homonek, my co-host, Todd Youngblood, I'm Todd Schnick. We'll see you soon on the Healthcare Insider.